I seriously need an answer to this question. Why do Americans, at least some Americans, love Obamacare? You know, I've been talking about this for years, ever since it was being proposed. I was against it from the very beginning. And I don't understand all these protests. And now we've got the second version of Tea Party, except now it's Democrats, liberals, progressives attacking the Republican congressman because they're trying to repeal Obamacare. I don't understand what's so great about it. Let me tell you where I come from. Let's look at the history of public-run healthcare, government-run healthcare, which is what Obamacare is. Really, the first entry into it was after the Civil War with veterans hospitals because so many wounded soldiers had nowhere to go. So the government stepped in, and rightfully so. World War II, it grew even more. Now we're up to 156 hospitals, over 1,000 clinics just for veterans. In case you haven't read the news lately, that's not going real well. There's some problems. There are some issues. And yet that is the one area completely controlled 100% by the government. And you know what? Who's more important than the veterans to take care of? And yet they're even screwing that up in a lot of ways. Well, then in 1965, we passed Medicaid. Now that was an insurance program provided by the government for people who could not afford insurance. Great safety net. 1966, a year later, we adopted Medicare. And man, when I hear people talk about Medicare, that's like the most awesome thing in the history of the world. Yet I hear that when you use it, it only pays about 50% of your medical expenses. What? I mean, you're paying for that when you work. All the decades you work, 3% of your money is taken from you. Of course, that's not for you. That's, a typical socialist program. You pay for somebody else. So all those years you work, you're paying for health care for the old people who are retired. And you have the promise that when you retire, all the young people will be working for you and paying for your insurance, that you'll still have to pay 50%. Don't get it. That's why you see all the ads for supplemental insurance for Medicare. Yet, to hear people talk about it, greatest idea ever. Well, then you have public hospitals. Now, these things have been around forever, and probably, I'd say 3 out of 4 hospitals in this country are public hospitals. Means they're owned by the government, taxpayers support them. And in the charter of every one of these public hospitals is this: if you don't have money to pay for insurance or health care, you're going to get served. I mean, you are going to be taken care of. If you have a pre-existing condition, you are going to be taken care of. No one is turned away at a public hospital. That's been there for decades. What a great safety net that is. But with all of that, Obama comes along with the Democrats and they say it's not enough. Now I got to have something else. And so we got this monster thing called Obamacare. If you never read it, I did when it first came out. It was like over 2,000 pages. I mean, this deep of paper. And it was an outline form. And you know what it consists of? It is taxes and regulations piled this deep. That's all that it is. There's no cure for cancer in that. I mean, there's no help to heart disease. It's strictly taxes and regulations. And so one question I'd love to have answered is, this big, massive thing that was passed and is now the burden of all of us, what percentage of our healthcare freedom was taken from us when they passed that thing? I would love to know. It's probably a pretty good percentage. Now, Democrats would love to have all of it. That's what they're going for. And we have to stop it. It'd be a disaster. It'd be terrible for healthcare. I mean, the bottom line for me is I just want to feel good. I want to be healthy. Insurance, that's a second thing. How it's paid for, that's a second thing. I want to feel good. But I am curious, would somebody please tell me why Americans are in love with big government health care? I don't understand.